my name is Dr. Marianne Brandon. I'm a clinical psychologist and certified sex therapist, and I'm in private practice in Annapolis, Maryland, USA. I'm here to talk to you about low sex drive in women, and I'll be speaking about my patients, Sarah and Jim, but I say that word in quotes because these aren't real people. I didn't have to change their names because they don't exist. They're actually composites of patients, and you'll probably recognize some of them in you. Sarah and Jim have been married for about 8 years. They have 2 children, and they're in their late 30s. Jim initiated their coming into treatment because Sarah had lost her interest in sex, and Sarah said that her relationship with Jim felt like brother and sister, so it was very hard for her to be interested in sex with him. Now I hear that all the time. People say that their spouses feel more like siblings than lovers. Low sex drive in women is the most common sexual concern, and up to 1/3 of women report concerns with their sex drive, although only 10% of those women are actually distressed by it. So if a woman isn't distressed by her low libido, we actually don't treat her. But if she is concerned about it, we talk about some basic things first, like the fact that female libido waxes and wanes over the course of her life. So there will be times when her sex drive is higher and times when it's not so high or low, like after the birth of a baby or maybe during menopause. So there's a natural process of waxing and waning. It's also true that female libido can be spontaneous, like a need for sex, but it also can be receptive, meaning she doesn't have necessarily a drive to have sex, but when her partner comes on to her, she responds, and that's a healthy female libido. So female libido can be receptive or spontaneous. Now, that being said, bodies don't lie, and ladies, if your libido is low and stays low for a period of time, and that's a concern for you, we take that seriously. What that probably means is there's something in your life that's out of balance. Libido is a very particular barometer of balance in your life. So if there's something going on for you emotionally or in your relationship or with your body, if something's out of balance, it's likely to trickle down into your sex drive. And that's because sex drive is such a sensitive barometer of balance in our lives in general. Because when we're making love, when we're having sex, that's when we're most vulnerable. It's when we're most exposed. So as far as treatment goes, what do you do? Well, ladies, unfortunately, there's typically no quick fix. What I would want you to do is see your gynecologist and make sure there isn't a physiological problem that needs to be addressed, like a low thyroid, or maybe your hormones are out of balance. And next, I would ask you to decide why you want your libido. You need to want it for yourself. If you're wanting to have a sex drive because your partner wants it, that's not a good enough reason. It's not going to work. You have to want it for yourself and think of what is it going to offer you to have a sex drive and to enjoy your sexuality. And next I would ask you, what do you think innately is out of balance in your life? Women often have an innate knowing about what's not quite right, and that's where we would start. So would it be emotional stress or depression? Would it be in your relationship? Are you angry or things not feeling well? Maybe it's in your body. Maybe you're tired, you're not sleeping well, your nutrition is poor. These are the kinds of things you would need to think through what's not right, and that's where you would start. It's also important that you have a strong connection to your body, which amazingly enough is hard for us these days to do. We're always thinking and we're staring at computer screens, and so we're in our heads and we're not in our bodies. If we're not embodied, we won't feel sexual pleasure. You can't go all day thinking, and then enjoy your body like a flip of a switch. So what I encourage women to do is spend time regularly tuning into their bodies and feeling their bodies, feeling pleasure. So that could be through massage or dance or yoga or meditation, whatever helps you tune into your body so that when it's time to make love, you already feel your physical self. Now, it's also important that sex is worth wanting, so of course, if your sex life is boring or not creative, you're probably not going to want to have sex. If you'd like more information about anything I talked about today, I co-authored a book with the director of OurGYN.com called Reclaiming Desire, 4 Keys for Finding Your Lost Libido, and you'll find answers there. Now, please be aware that these videos are not a substitute for treatment, so if you have concerns about anything we talk about, talk to your doctor. However, we do invite you to speak up on our forums at OurGYN.com, and I'll do my best to respond to you. So thank you very much. Keep in mind that, as always, great sex is important, but more importantly, it's part of a bigger picture of learning how to give and receive love better. Thank you.